Hi friends, welcome to a session on medicine of the CPT manual. This section of medicine is going to be a gray area for many medical coders because so far we have been dealing with all the procedures in the surgical part, the EM part and all of that. So whichever cannot be classified as a surgical procedure, so automatically they find their entry or they find their inclusion in this part of the CPT manual. So here you need to know about most of the surgical, it's not surgical, non-surgical tests and all those procedures which these specialists perform actually. When we see this surgical part, we had specialty providers like dermatologists, gynecologists. They have the procedures in their own section, but whereas here we find the entire group of these professionals services will be listed under this section, and that's why it's going to be a complex topic, so where you can just try to understand and comprehend a little by little. So here if you have a core knowledge of medicine or if you are a specialty coder, you can fairly understand these procedures because we have like ENT procedures, eye procedures, cardiovascular procedures, allergy procedures and all of these, or services or tests, battery of tests. So not everyone can have very good idea of all of these, but thing is you can certainly understand what the test is and what is the purpose for. If you know it, that is fair and good. And end of the day, you can easily capture the code considering certain special criteria. So here, to begin with, we are going to start with immunization. I hope all of you know what an immunization is. You should not be confused with the word vaccination. Immunization is a process by which the organism's biological status, which is the immune status, is being fortified with. And one way of just immunization is a vaccination. So many tend to use these terms immunization and vaccination synonymously, but that's not always true because a vaccination is a form of immunization, but immunization is not just vaccination. Okay, so here we will be talking about the vaccines and the toxoids that are commonly administered in order to protect an organism from any infectious diseases. Say here we have vaccine. So a vaccine is a biological agent, it is actually a biological preparation which is being inoculated into an organism so as to protect this particular human being or animals from a particular infectious disease. So here we have toxoids as well. So what are toxoids? Toxins are substances that are produced by these bacterial agents. We have like exotoxins and endotoxins, and which have their own deleterious effect on the human organism or any particular, if it's going to be animals. Okay, but whereas these toxins are converted into inert substances, hereby they do not lose their antigenic property. Okay, they are still capable of being antigenic, that means with the stimulation of antibodies, but they have lost their toxicity nature.